Hello and welcome to Hepatitis A, the preventable virus. My name is Nicole Holmes and I am a provider training coordinator for the Philadelphia Department of Public Health's immunization program. Before we get started, we have just a few objectives. Understand the background of the hepatitis A virus, understand the United States hepatitis A vaccine requirements, and understand how to apply the presumptive approach. Background: Hepatitis A. Hepatitis A virus, also known as HAV, but commonly referred to as Hep A, is the inflammation of the liver that causes mild to serious illness but does not cause chronic liver disease. It spreads through person to person contact, consuming contaminated food or drink, and infection occurs when ingested. The at risk population includes international travelers, men who have unprotected sex with men, people who use or inject drugs, people with chronic liver diseases, including hepatitis B and hepatitis C, people whose job increases the risk of exposure to hepatitis A, people who anticipate close personal contact with an international adoptee, pregnant people, and people experiencing homelessness, and also people living with HIV. Now, you'll notice that some of these categories of populations have one asterisk and some have two. People at risk for HAV have just one asterisk. Now, people at an increased risk for severe disease from HAV infection have two asterisks. The incubation period is usually 28 days, ranging between days 15 and 50. Hep A symptoms include dark urine or clay-colored stools, diarrhea, feeling tired, fever, joint pain, loss of appetite, nausea, pain in the right side of the abdomen, vomiting, yellow skin, or eyes, also known as jaundice. The best way to prevent hepatitis A is by getting vaccinated, and you can learn more about recommendations and options for hepatitis A vaccine by visiting the cdc.gov. The Hep A vaccine schedules. Here is a look at the ACIP recommended pediatric vaccine schedule. And here is a closer look at the pediatric vaccine schedule, highlighting the hepatitis A vaccine. If you notice at the top, we have several months and years of the patient highlighted in a red order. And then just below that, you'll see a few different boxes, the color purple, the color yellow, and the color green. We're going to get into those and what they mean in just a minute. The hepatitis A vaccination for routine vaccination is a 2-dose series, and the minimal interval is 6 months, starting at ages 12 months to 23 months. The catch-up vaccination schedule is for unvaccinated persons through the age of 18, and they should complete a 2-dose series. International travel. Infants ages 6 months to 11 months should get 1 dose before departure, and then revaccinate with a second dose separated by about 6 months between ages 12 months and 23 months. An unvaccinated child aged 12 months or older should administer 1 dose as soon as travel is even considered. And here we have the VFC available vaccine list. If you have any questions about the vaccine list or the vaccines that are available for order, please don't hesitate to reach out to us at dphproviderhelp@phila.gov. Now I want to draw your attention down to the bottom of the screen where you see the red box. Those are the Hep A vaccines available to order through the VFC program. Here we have Haverix and Vecta. Both are packaged as 10 doses per pack and come in pre-filled syringes. And here's the ACIP recommended adult vaccine schedule. And here's a closer look at the adult vaccine schedule, highlighting hepatitis A vaccine. At the top, that is the age group. And then just below that is the section where notes are. The routine vaccination for Hep A for adults is that anyone who is not fully vaccinated and requests vaccination can get one. Just be sure to read the rest of the notes carefully. Special situations include any person who is not fully vaccinated and who is at risk for a hepatitis A virus infection or severe disease from hepatitis A virus infection. Those people should complete a 2-dose series. Some risk factors include chronic liver disease, HIV infection, men who have sex with men, injection or non-injection drug use, persons experiencing homelessness, work with hepatitis A virus, people in countries with high or intermediate endemic hepatitis A levels, and close personal contact with international adoptees. And also rounding out that list is people who are pregnant and then settings for exposure. All of these people should be vaccinated against hepatitis A. And here is our VFAR, or Vaccines for Adults at Risk, available vaccine list, highlighting the hepatitis A vaccine and the combination hepatitis A and hepatitis B vaccine. These are vaccines that are available for order through our VFAR program. We have Haverix, Vacta, and Twinrix. All of these vaccine products are packaged as 10 doses per pack and prepared in pre-filled syringes. The presumptive approach. The first approach is positive assumption. Healthcare providers expect patients to agree with or accept recommendations like vaccines or lifestyle changes without needing much convincing. And that's not always the case. Sometimes you have to do a little bit more work to get a favorable outcome. The second approach is streamlined communication. This approach makes communication simpler by focusing on the likely positive outcome instead of potential objections. The third approach is encouraging engagement. Assuming a positive response encourages patients to take action more easily. For example, instead of asking if a patient wants a vaccine, the provider might say, "Hey, let's schedule your vaccine today. You're due for your Hep A." Or they may say, "Your child is due for their Hep A vaccine." The fourth approach is promoting adherence. Now, this method can improve how well patients follow health advice by presenting recommendations as the norm, making it easier for patients to comply. To summarize the previous 2 slides, here's a nice infographic to illustrate the presumptive approach in 3 easy steps. First, safely assume parents will vaccinate their children. If parents consent with no further questions, go ahead and administer the recommended vaccine dose. If parents are not ready to vaccinate, move to the second step, which is give your strong recommendation. Here is where you remind or explain to the parent or patient that by vaccinating their child or themselves against MMR, they're protecting them from all the symptoms, complications, spreading the disease or virus, and that the vaccine is a school requirement. If the patient or the parents accept your recommendation, go ahead and administer the recommended vaccine dose. If the parents or the patient has specific questions or concerns, move on to the third step, which is listen and respond to the parents or the patient's questions. Now, if the parent or patients respond positively to your answer, go ahead and administer the recommended dose. What a win. To further educate your patients, you can leave them with the Vaccine Information Statement, or VIS for short. This document should be on hand and offered to each of your patients. You always want to give them the choice to decline rather than assuming that they won't want to read up a bit on the vaccine they're due for or considering getting. And here are the key takeaways. Hep A can be prevented by vaccination and proper hygiene practices. And clinical providers should always use the presumptive approach when speaking to patients about vaccinations. You have access to more information than you know. Visit our newly designed website to order more educational materials for your practice, classroom, or office at no cost to you. Head to vaccines.phila.gov and in the search box, type in available and click enter on your keyboard. Once you do that, your screen should look like this one. And going from left to right, we have available VFAR vaccine, available VFC vaccine, and available vaccine flu. Now, these are updated on an as-needed basis, and one cool thing I love about this website is that everything is in alphabetical order. And here's a snapshot of our current Hep A materials. And here are the resources used. Just so viewers know, all information was pulled from reputable resources including the FDA.org, WHO.org, CDC.gov, Immunize.org, and Vaccines.phila.gov. Thanks so much for watching, and we'll see you in the next one.